That's my little therapy session done. Speaking of big experiences, let's talk about breasts.
Yes.
Let's talk about breasts, okay? And whoever else is listening, because I know it's not just dads. And I feel like there might be a solution.
There may
Maybe.
be. There may be. I would highly, highly recommend for all partners.
40 weeks for men. 40 weeks for men. 40 weeks for men. Hello, hello, hello. Welcome to another episode of 40 Weeks for Men, a resource for men by men in order to help us dads be the best we can be in this crazy, crazy world. So, as you know, 14 Weeks for Men is all about families, all four families. So, today we're going to be carrying on in our series of our partners' pelvises in pregnancy. We're going to be carrying on with that. And today we're thinking about recovery after birth. So I've got my special guest again, which I'm very glad about. He's going to help me think about PPPs, so our partners' pelvises in pregnancy, and think about recovery after birth. So we're going to talk about that today. So do you want to introduce yourself quickly and then we'll get started?
Sure. Yeah, I'm Lynn Shulte. I'm a pelvic health physical therapist. I specialize in birth healing, and my focus is helping moms prepare their bodies for a better birth and then recovery after birth as well. So I specifically work with pregnant and postpartum women in my clinical practice, and I also travel the world teaching and training other body workers how to do the same.
Pretty good thing, pretty good thing. So today, Lynn, you and I will talk about this recovery after birth. We're trying
Yes.
to use the dads that listen to the podcast and whoever else is listening, because I know it's not just dads, but whoever listens to the podcast, hopefully we'll try and be able to give them some good encouragement, some good knowledge. Let's talk about recovery after birth.
Yes. Well, I think, Chris, the first thing that I want everyone listening to know is that after a baby comes out and the placenta is delivered, that placenta leaves a dinner-sized plate wound inside the uterus.
Yeah,
And that wound is part of what the bleeding is about afterwards. So moms, will be bleeding after the baby, and that can last a couple of weeks, that
yeah,
bleeding. But that's that wound kind of healing. And some women after they give birth, their physicality, their body looks fine, like they're able to get up and move and walk around and they have no problems. But
mm,
and it's so easy for anybody looking at a person who's just given birth to think, oh, she's fine. She should be able to go back to life as normal. But
yeah,
what I want people to remember is that they have that dinner-sized plate wound that is healing inside their body. We
mm,
can't see it. We can't see all the traumas, the micro tears, they've done MRI studies of women after birth, and they look like a sports injury has happened to their pelvis because there's micro traumas and micro tears. And, some women do tear, some people have episiotomies. And so they've cut their skin of their perineum and that area down there,
yeah,
and
yeah,
and so all of that needs to heal. And it's just so, so important that women really rest and recover after giving birth. And
yeah,
especially those births that are like days long. I mean, it is quite the feat what a female
yeah,
body does to get that baby out. And I want especially the partners listening into this to remember that their body, they may look healthy, they may look fine, but their body really needs that rest
mm,
and that ability to recover. And I have to say, in my practice, the women that take the time and really just rest and do very minimally after birth are the ones that recover the best after birth.
Yeah,
And
yeah,
and we're
yes,
really looking at the long term here, not the 2 weeks after birth, but the 40 years after
yeah,
birth. So the impact birth has on the body can last a lifetime.
yeah,
And and that's really what I'm trying to get out into the world is that not only do, we have the bleeding, we have the wound size, we have the episiotomy, we have the tearing, the scar tissue that happens. If someone's had a C-section, that's massive scar tissue in the lower abdomen. They shouldn't be picking things up. They shouldn't be, really lifting a lot after birth. And I
yeah.
try to tell my mamas 5 days in bed. Just lay down 5 days in bed. Now, that doesn't mean that they're laying there and doing nothing for 5 days. They could be doing some leg lifts, some leg slides. They could be engaging their core while they're, laying in bed. So there are things that they can be doing to help with their strength. But for the most part, they're laying low because the body just pushed this amazing human being out of their pelvis,
Mm,
and that's a lot of downward force that has happened to the body. And
yeah.
so not being upright to encourage more of that downwardness, but being more horizontal can help minimize the effect of that downward pushing that they just did during that birth process.
Interesting stuff. So I want to say down there as we speak, right, is a very mysterious place for lots of us men. But there's lots of other mysterious things that I think it's really wonderful that you and I can shed some light on today. One of the mysterious things that I don't think a lot of partners know about is the placenta. What do you know
Yes.
about the placenta?
Well, it's the life-giving force for the baby. It's all the nutrients that kept the baby alive.
Mm,
Um, and a really beautiful, healthy placenta means the baby got lots and lots of good nutrients.
yeah,
A placenta that doesn't look as good means that baby really didn't, struggled or may have a lower birth weight but
yeah, good point.
that placenta is the nutrients that baby gets. And it's really, really important after birth to make sure that placenta is intact
Mm,
and that every little bit of the pieces of the placenta comes out ideally intact.
yeah,
And I really there's some practitioners out there that feel like they have to like tug to get that placenta to disconnect. And it can leave parts of the placenta in the uterus. And that can cause problems and infections and
yeah, I've
issues
heard
for
about
the
that.
moms where
Yeah,
they'll need to go back in. And the making sure that they get every single part. So as a partner, you could make sure that placenta looks a whole and intact and ask the
yeah, that's
provider,
a good
did
point.
we get everything?
It's a really good point. Partners can do that. Yeah, yeah,
Yeah, that's a great job.
yeah, it's a really good point. So yeah,
Yeah.
I think what I'm hearing from you so far is that we can really help our partners recover well after birth by helping them rest and realizing actually that a big deal has happened. They've got a big
Yes.
wound. It's a big deal, and helping them rest and helping
Right.
them maybe decrease the vertical transmission of things and like maybe lie more horizontal once in a while. I know everyone's scared about blood clots and all these things that can happen to
Yeah.
people, but like you said, people aren't just sitting there doing nothing. They're moving
Right.
around, but you know, resting is just as important as movement afterwards.
Absolutely. And what I tell my mamas is like, look, your job is to get to know the signals from your baby.
Yeah, good
Your
point.
baby is telling you information with their facial expressions, with their mouth, with their sounds. That different
Yeah.
sounds mean different things for babies. And your job is to kind of start to read those and to realize that when you that the movement of the tongue of the baby's tongue, it's like that baby's starting to get hungry. And so you
Yeah.
can use and watch for those cues. And, you know, if they're yawning, that means that they're starting to get tired again. And
Right.
so you know, that's your job. That's your goal, is to really start to pay attention to baby's cues.
Maybe you can help with this because, like, I want to tell you something. So, like, for me, it was hard because the first time that we had a baby, I was just like, "Where's this baby? Okay, I need to learn how to change a nappy." And I feel like a lot of dads go through this; they just don't really know what they're doing. And then by the time the third one came along, I was like, "Right, I'm really gonna be involved now. I'm gonna make sure that I hear the sounds and see the gestures and like be involved in this baby." Like I feel like it would have been wonderful to be like that with the first one.
Yeah.
That
Yeah.
wasn't. And like,
No.
yeah. How do we get that same personal conviction to be involved, do you think?
I think it's just with education and learning, and you know,
Yeah.
and I would highly recommend for all partners. We talked about a birth doula.
Yeah.
This
It's,
is a person that's specially trained in helping especially trained in helping people during birth, but there's also postpartum doulas.
yeah.
And if you interview the different postpartum doulas, they can educate you and teach you about the signs that the baby's giving you so that you are much more capable of handling and understanding your baby. And
That's
so get support. And there are, I know here in the States, there's lots of like lactation support groups. There's sleep experts. There's baby experts all around us. Like the internet, the social media is just full of amazing information. So
yeah.
start educating yourself, start looking at, you know, I know there's Oprah Winfrey had on her show years ago a woman who had different sounds that the baby makes and what those sounds mean, like a nah, yeah, nah, you know, like and that meant something versus a you know, and so there's that
Yeah.
video out there on the internet. Go search for it, guys. You know, the
Mm.
what the different sounds a baby makes, and then see if that rings true with your baby. So
Education.
educate yourself, find the, you know, babies are constantly trying to communicate. They can't talk to us, but they can through their sounds, through their gestures, and all of that. So start paying attention to that and see if you can figure out what your baby's trying to say to you.
Yes.
So educate yourself, educate. If you can't find the information yourself, hire those people that already know it and they can help guide you
Yes.
in
That's a
that
good point.
care.
I'm gonna do some research for myself because I'm not sure if we have an equivalent in the UK of a postpartum doula. But
Okay.
yeah, I'm gonna do some. I'm sure we have something like that. I think the health visitors. I think because the health visitor comes to see you, but I don't know if
Yeah.
there's like a specific person that will help you with like the issues of being a postpartum dad. But I
Yeah.
like that. It's pretty cool. That's in the same,
There,
right?
yeah. So these, you know, we call them doulas here in the States. So
Yeah.
you'll have to figure out what they call it in your country. But
Yeah. Well,
there
yeah.
there are people who are educated in understanding babies' lingo, babies' signs, babies' cries, and they can help you to learn. And you know, breastfeeding, a lot of women choose to breastfeed, and as a partner, you just need to know that that is not a it is a natural thing, but it does not come easily to both baby and mama. And
Yeah.
there's a lot of issues. And so I always encourage my pregnant clients to go sit in on a lactation circle or mama's milk circles, or to go listen to other mamas who are breastfeeding their babies uh, in before the baby's even born, because then you know, you're not as sleep deprived, you're way more attuned to what's going on versus after the fact you're in survival mode. You know,
Yeah.
do this training ahead of time and really understand what you hear from other mamas, because we don't live in community. In the, you know, olden days where we had family all around, our moms and grandmothers, they were passing down this
Yeah.
information to
Yeah.
the, you know, pregnant and newly postpartum women, but they're not around as much anymore.
Yeah, true.
And so we need to get this information from someone, and it's out there. So just Google in your area,
Yeah.
postpartum support, lactation services and sleep consults. And because, the one thing that is so true about babies is once you get them figured out, they change,
Yeah, yeah. Once you finally
right?
understand, they change. Good point.
They
So,
change.
mm,
So you're
yeah,
always needing to evolve and learn the new
learn
next
new things.
stage of
Yeah,
development for a
yeah.
baby. So, but I want to go back to a mom because
Go on.
um moms, one of the things that I've discovered in working with postpartum women is that the bones of the pelvis don't always return to their original position after birth.
Mm,
Okay, so the bones have to open up for the baby to come on out vaginally.
yeah,
And the sit bones, those bones that if you're sitting right now, you're sitting on your two sit bones, your ischial tuberosities, and those need to splay apart. And then your tailbone needs to lift backwards for a baby to come on out. And sometimes those bones remain in what I am coining the open birthing pattern of the
an
pelvis.
open birthing pattern of the pelvis. Yeah,
So that the bones don't always return to their original position after birth. And this can leave a person who's delivered vaginally. Sometimes the one ischium splays out more than the other, depending on the position that the mom was in when the baby came out. So if they're laying on their left side, as the baby comes out, their right side tends to splay more than
yeah,
the other side. If they have one leg bent up more and the other leg straighter, the side that's bent up will get pushed out to the side more as that baby comes on out. So
mm,
just depending on the situation and the position, the pelvis can get affected from birth, and they don't always come back together. But there is something that you as a partner you can do with your mamas, and that is there's an exercise that I have on my YouTube channel. We'll make sure we put the links in the show notes. But
yes,
you can do this with your partner right after birth, even in the hospital, the day after baby comes out. And it's just using squeezing the knees together and then squeezing the knees apart and resisting these motions. There's three different positions you do this in. And that can help use the muscles to help bring those bones back together again to the midline after birth.
good shout. We can
And
do
it
that.
is
Yeah,
so important because all the pelvic floor muscles attach to these bones. And so we want to make sure that the bones are in their natural position so that their pelvic floor muscles can function better. It just helps with recovery. The scar tissue, if they tore or if they had an episiotomy, won't be on stretch as much. So it's going to have a greater chance of healing easier.
yeah.
Your opportunity to have intercourse down the road is going to be greater if the
See,
bones
I was
aren't
just
on
gonna say
stretch.
that we talked about the open birthing pattern when we did our sex after birth
Yes.
episode, and like we learned loads there about the open birthing pattern. So we're definitely gonna be able to do some more about that. Go on. So
Yeah. So these exercises, I have a video of it on YouTube that you can watch and do that with your partner. Do it for the first week after birth, every day. Just do it once a day.
that's a
And
really
that can help remind the bones to come back together.
to come
Okay.
back together after birth. It's a really good
Yeah.
idea because yeah, we're thinking about our partner's pelvises in pregnancy after birth, recovering, and like all of these things we can actually do to help speed up the cup and actually to realize that actually our partners have been through a big experience.
Yes.
Speaking of big experiences, let's talk about breasts.
Yes.
Right, let's talk about breasts, okay? Because the thing is, Lynn, everyone seems to have a different. Because some people choose to breastfeed, some people choose to not, and like I know the thing is out as to whether you should always breastfeed and whether you shouldn't. But like, what do you think about it?
Well, I think if you can, you should. And if it works for the mom and the baby, then that's ideal. So, the saying is breast is best.
Yeah.
However, fed is best.
Yes. Fed
Okay.
is best. Yeah.
Yes. So, and there's a lot of guilt around moms that are
Yeah.
unable to breastfeed. And
Yeah.
I do there's a lot of magic that happens in the exchange of milk from the breast to the baby as far as
Yeah.
antibodies go and helping the immune system. So if when baby goes to daycare and there's a cold or a flu or whatever's going around in
It's
daycare.
going around. Yeah. Virus. Yeah.
Yeah, if baby breastfeeds with mom, like there's magic that happens at the breast to
Yeah.
help increase the immune system of the baby.
Yeah.
So mom's immune system is helping baby's immune system and vice versa. So there's a lot happening with the breast now. There are some women whose tissue, their breast tissue, their nipple is not, it may be inverted. It may, like there's
Yeah.
difficulty with getting,
Difficulty latching and
the
creating.
latching is a
Yeah.
challenge. Tongue ties, Chris, are
Mm,
just huge.
mm,
And tongue ties is where the baby's tongue, you should be able to open your mouth and then be able to put the tip of your tongue on the roof of your mouth with your mouth wide open.
Yeah.
And that little string that you see underneath your tongue should allow enough movement for the tongue to hit the top of your roof. But
Yeah.
baby, you can see it when they cry. It's just tethered down and their tongue just stays held down.
Mm,
And then also their lip. You should be able to take the top lip and be able to fold it backwards. And that little string should have enough freedom and flexibility for that lip to be able to move. And
yeah.
if tethered down, then the
Yeah.
baby's mouth can't create the suction that it needs to happen for the milk to come out of the breast.
Mm,
And so tongue tie, I don't know about over in the UK, Chris, but it is like very prevalent here, this tongue
really.
tie issue.
Mm,
And I just hear more and more and more of my clients are dealing with tongue ties with their babies.
mm,
And the sooner that can get addressed and released, the better off the breastfeeding experience can get.
mm.
The longer it takes, the more challenges there are. So
Good point.
um, if your partner is struggling with breastfeeding the baby and the baby is just not latching on and getting a good transfer of milk,
Yeah.
then please get their tongue and their lip evaluated by an oral dentist that works with babies
Good point.
and knows how to assess and treat any restrictions to that so that baby's able to transfer that milk better.
Good
And
point.
so, just know, partners, that breastfeeding, while it is natural, it is not always easy. And it takes a lot of effort and energy for a person to breastfeed their baby. And
Yeah.
one of the things, this is my own personal experience, and I want to
Tell
just
me,
give a
tell
tip
me.
to every partner is no matter, like, especially early on, you got that new baby and you got to get all situated. You got the pillows, you got the baby on, you got to get them in the best position. You got to have the pillows to support them and to support yourself and everything. And you finally get the baby latched on and they're breathing and they're feeding. And oh my goodness, the thirst, the quenching
Yeah.
thirst that hits a mom's breastfeeding body and mouth is like, oh my God, damn it, I forgot my water.
Mm,
So, partners, every time you see your partner breastfeeding, bring them water. Make
mm.
sure they have water nearby because they need it. So, that is your job. That is your job during the breastfeeding phase of baby's development. Every time your person is breastfeeding, you make sure that they have water nearby
It's a
for
good,
them to drink.
a pretty good shout. That's a pretty good shout. My
Yeah.
goodness. There's so many things that we can actually do that will actually help our partners so much. And not just help our partners, but help our families. And
Yes.
actually, yeah, help our families much, much more. So I'm thinking now, obviously we have a slight difference because you're across the bonds and I'm here, but it's
Yeah.
fine because there's so many transferable skills and so many transferable things that are not unique to just America and not unique to England, but they're the same. And I feel
Yes,
like this idea that people don't realize that this is the big feat. Having a baby is a massive deal. And
yes,
actually, just bringing voice to that, I think is a big deal in itself. Just making people realize that actually the wounds that a birthing mother will have to recover from really does make a massive difference. And a lot of the time, I think us men can just feel like, oh gosh, this person just put me first. No. A lot of the time, they need to actually put the baby first and themselves first. And actually, I think hearing this and thinking about education will help men and fathers, partners realize that I need to have my wife put herself first, or my partner put herself first, or and my child
yeah.
first. But yes, that thing I wanted to ask you, you and I may argue about this, but it's okay.
Okay.
It's okay. I personally don't like breastfeeding.
Oh, really?
Yeah, I don't. Reason why I don't like it is because like I just feel like dads want to get involved and I feel like we
Uh,
excluded because I
yeah,
can't breastfeed my girls. All three
right.
of my girls have been breastfed. So I'm all for the lady expressing and
Yeah.
I'm all for formula. But my wife tells me about this thing. There's a bond that happens between
Mm-hmm.
baby when you breastfeed that you
Yeah.
can never sort of like understand. And like that really upset me for a while. But maybe
Yeah.
I just need to deal
Well,
with my emotions.
Chris, I totally understand your point of view because it's an extremely sweet, sweet bond that a mom has while they're breastfeeding. However, I think a partner's job is, you know, you need to help that baby get used to a bottle as well.
Yeah,
Because, like 100% breastfeeding is very, very taxing for a person. And to for a mom to have the freedom to be able to go away more than 2 hours from a child is super helpful. And if a person can pump and put express breast milk and you freeze it, and then a partner could then feed the baby
yeah.
in, through with the bottle or whether it's formula or whatever it is. But I think that that partner needs to have that time of being able to feed as well.
Mm.
So I think that, because a lot of, in today's day and age, mom's got to go back to work.
Yeah,
That
good
this
point.
day and age of being able to stay at home for your moms is going by the wayside, unfortunately, for
Good
most
point.
families.
Good
And
point.
so babies need to learn how to get a bottle in. And so then that's dad's role is to, because if mom tries to give the bottle, baby's going to be like, no, I smell your breath. I want good, I
Yes.
want the good thing, right? And so babies are so intelligent
Yeah,
that they know when they're with dad, they know when they're with mom. And one thing that I would love dads to understand is that it is okay to have daddy style. You
yeah,
do not need to do everything exactly like your wife does or your partner does because
yeah,
the baby's adaptable. The baby will know that, oh, I'm with dad and dad does it this way and mom does it this way. And it's okay. It's okay. It does not all have to be done the same. And so that could be a little challenging if your partner is full of control and is like someone that has to have things done her way. And
yeah,
it's important that you have your own style and your own way of interacting with your children because that's special in and of itself. And
yeah,
children need that. I mean, they need an involved partners. They need both partners to be involved in the raising of a child. And it shouldn't just be done one way. You got to help your kid be adaptable and help them to learn that there's different ways of doing things in life. And daddy has his own way, and that is just as good. Okay.
yeah. That's a good
So
point. That's a good.
that's really important. And that being able to support the breastfeeding, the chest feed, the bottle feeding, whatever it is, you can be involved in that. But I do have to say that there's something magical about the bond with baby and
Yeah,
mom and about the antibodies and just what happens between breast and milk and babies. Like the mom's breast can take the bacteria or whatever a baby picked up in daycare. It
Yeah.
takes it into the breast milk, creates its own antibodies, and then gives it back out to the baby to help it to fight whatever it just encountered. Like, that's just flippin' amazing to think
Amazing.
about.
Yeah. Good.
Amazing to think about. And
Good.
so that's why I think that, breastfeeding is, I get your point, Chris, totally get it. But I think it's so important that if
Good
we
thing.
can, we should. But I also feel I've also had clients who have tried their hardest and tried their darnest for months and have literally gone to their wits' end trying to breastfeed their baby, and they just couldn't.
Yeah.
And you have to be okay making that decision of like, okay, this is not working for either baby or I. We need to choose this option next. And then that does allow the partner to be way more involved in the feeding of the child, of the baby.
That's a good
Yeah.
shout.
Yeah.
Lynn.
So
Yeah, that's my little therapy session done. You could say something, I cut you. Good.
that's great. Well, one thing I also want partners to know and understand, especially for our moms, is that when we are breastfeeding and we're caring for our baby and we're looking down at the baby a lot, there's a lot of curling forward of our
Yeah.
body, our head forward, our shoulders come forward.
Yes.
And so, what I would really recommend to help keep greater balance in your head and shoulders is if you can get an exercise ball, one of those big
Yeah,
balls
like
that you
one
can
of those
sit
big
on.
things that you do yoga on, and yeah, yeah,
Yes. Yeah, yeah, yeah. They're awesome for bouncing a baby on, but they're also awesome for dads too. If you're carrying your baby around and you're, looking down at that baby a lot, you spend a lot of time looking down at that baby. Lay over that ball and get your arms back behind you and really stretch out your shoulders and look up and, stretch out the front of your neck. Have your partner lay on that ball at least once or twice a day to really help them to stay as stretched out. That will really help any mid back, upper back pain that they're getting because
yeah,
they're just too far forward. They need to, like, if your partner can do a back bend, have them do a back bend, but you can easily do a back bend over that ball. It's really way more supportive. But that reaching up and stretching your shoulders back, like I tell my mamas, every time you walk through a door, reach up to the corners of the door and then let your body kind of walk through and just
yeah,
stretch out your shoulders so that you
yeah,
get that flexibility in your neck and your shoulders as you're caring for these new ones because
yeah,
it's a lot. It's a lot to
yeah,
carry
yeah,
around, 12, 13 pounds. It gets up to 25 pounds very quickly, and you're
yeah.
carrying that around in your arms all day long. It's a lot. So your body needs that stretching out and doing the opposite of what it's doing all day long.
Good shout. So, Lynn, let's go back to the pelvis. Let's think
Okay.
about
Yes.
it again. So, how do we help as dads, partners? How do we help our partners get stronger in their pelvis when it comes to recovering from birth?
Yeah. Well, the first step is doing that closing of the bones exercise.
Yeah.
Okay. And then it's super important that your partner figure out how to get those pelvic floor muscles activating again.
Yes.
So doing a Kegel, that's the name of a Kegel.
Yes. What do you
Okay.
think of the Kegels? Because, like, yeah, my
So
wife really liked them, but I don't know if
yeah.
it's a like thing or whether you need to just do it.
Well, so here's the thing, Chris, is that if you didn't have an episiotomy, if you maybe didn't tear very much, and your bones are able to come back together again, it's way easier for you to do a Kegel after birth. But
Yeah.
there are so many factors that I find in my practice that keeps the pelvic floor muscles unable to contract fully after birth.
Mhm.
And some women need support.
Mm.
And so several things. So the bones being out of position, that can cause the muscles to be weak. And so a person tries to do a Kegel or tries to contract their pelvic floor muscles, and it's just like, oh, they just can't, nothing comes to the party,
Yeah.
right? It's just
Yeah.
like, I'm trying to do something and nothing's happening.
Yeah.
If you have all these things I'm going to list off here and you don't address them, It's like and you just keep telling someone, oh, just keep doing Kegels, keep doing Kegels. It's like trying to hit your head against the wall to get rid of a headache. You know,
Yeah.
it's not going to change anything. If you don't have a good, like, normal strength is being able to contract and hold your pelvic floor muscle contraction for 10 seconds and then being able to release it and relax it back down. Now that's normal strength. It's very rare right after birth that anyone has normal strength in those muscles because they just got lengthened to, I think it's 10 times, their length to have a baby to come on out. So they're really, really overstretched and lengthened. So getting the bones back into place, releasing the scar tissue in there. Also, when the baby comes out of the pelvis, it rearranges the furniture in the pelvis. So it
Mm,
can smush the bladder off to a side. The cervix can be anywhere internally after birth.
yeah, you
And
said
sometimes those organs need some help getting back into their proper place and releasing the scar tissue. And then the muscles can just function so much
this.
better.
Mm,
So I have a list of people that have trained with me on my directory. I know there's a lot of them here in the States.
yeah.
Um, they're elsewhere in the world. So you could check out my directory to see if there's someone in your area that can help you, that
How do
they
we
know
access
the
it?
protocol. What
How
was
do
that?
we access your directory? How do we access it? How do
Yeah,
we?
instituteforbirthhealing.com is the website. And on the other resources at the top of the menu bar, you click on other resources and it'll drop down and it says directory. So you guys can check there to see if there's anyone nearby you that knows the work that I'm talking about here. And if you can find someone that knows what I'm teaching and is implementing it well, you'll get better a lot faster.
Question, but
What?
is there a way for, let's say, there's a physiotherapist who, so I know a couple, but let's say there's one that wants to learn more about how to help birth healing. How would they get involved with you?
I have online courses. They can take any of my online courses at the instituteforbirthhealing.com. So have them just go to my website and check out. And a lot of what I'm talking about today is covered in the holistic treatment of the postpartum body course.
Good.
Yeah, and a pelvic health physical therapist can help you. If they understand what I'm teaching, they're going to be able to help you a lot faster. If they don't, it's just going to take a lot longer.
Mm,
That's my experience.
yeah,
So people who study with me and implement what I teach are amazed at the improvement that they're seeing in their clients that used to take months for them to get better. They're getting better in days.
yeah,
So
this is it.
it's just knowing what to look for and how to treat it makes things work so much better.
Yes.
So I just want, partners to understand that the pelvic floor muscles are meant to be able to contract and hold for 10 seconds and then relax back down. And if your partner's having a hard time being able to do that, they may need support by a pelvic health physical therapist or someone who has trained with me in my directory. And being able to, one of a great ways to work on the strength is actually if you are having intercourse and your penis is inserted, have your partner squeeze around that penis and work on that. That's the pelvic floor muscles actually strengthening, and you can use that
Wish I
as
knew about this. Wish
well,
I
Chris, you can
knew.
still do it.
Good point. Good point.
So that, having something in there and something to squeeze around can give more feedback for your partner to be able to do more. So that's something that you guys can work on together.
Yes.
But the muscles, getting that strength is also really important. Now, the other important piece, the pelvic floor muscles is one part of their core musculature that needs support post-birth, but also their belly does as well. So a lot of moms are not happy with the look of their belly after birth because that
Yes.
belly got stretched out. I mean, think about how big it got carrying that baby. And those muscles are just lengthened. And especially the lower muscles below the belly button, they tend to be more stretched out than the muscles above the belly button. And so
Mhm.
one
Yeah.
of the there's a cough test that you can do if you have your partner put their hand above the belly button and another hand below the belly button, and then they cough. And if that lower belly juts out when they cough, that means that their lower belly is not engaging as much, and they may be putting a little bit more force down on their pelvic organs. And so that lower belly needs support in learning how to re-strengthen after birth so that it comes to the party. And it just like it gets so stretched out and lengthened that it's just like lazy. It doesn't want to come to the party because it's just too stretched out. And so it needs that re-strengthening again to get them working on their core again. Now, there are a ton of online core restore postpartum exercise programs. The ones that I'm a big fan of is restoreyourcore.com. There's also the bloommethod.com that has a monthly subscription to, you can pay per month for learning, but there's a foundational information that you need to learn and get into your body before you start going and doing your major workouts. So you need
Yeah.
to get your belly, moms need to get their belly and their pelvic floor muscles working better before they start going back to their exercise routine they did before they got pregnant.
So you need to realize it's a big deal, because here in the UK, well, my wife calls it the faux pas. Faux
The
pas.
what?
Faux pas.
Faux
That's how
pas.
she nicknamed her belly after the pregnancy. The faux pas. She was
Okay.
like, "Oh, I can't get rid of this faux pas. It's impossible. It's stuck with me here for life." And like, I feel like there might be a solution.
There may
Maybe.
be. There may be. And I have a confidence in the pelvic floor core and more course online that talks about working on this end range contraction.
Did not get that. You gotta say that again. Focus. What
Confidence.
did you
Yeah.
say?
It's confidence in your
Confidence,
pelvic floor,
your pelvic floor,
your core,
your core,
and more.
and more.
Yes. So
Love
that's
it.
that's my online program to educate moms about what's going on in their body after having a baby, what happens to their abdominal muscles as to why their belly has that faux pas,
Yeah.
that why that's there, and then what you can do about it.
Yeah.
So that's a resource for moms as well.
Yeah.
And yeah, no, there's something that you can do for your belly after birth. And it's super important that moms do something to re-strengthen their core and get their core working in a supportive way.
Yes,
Because
good
what
point.
ends up happening is that when they're 60, 70, 80 years old, the
Mm,
effects of their birth now catches up with them, and now they're peeing their pants when they sneeze or
yeah.
cough or leak. Now, this may be happening to moms right after birth too. And so that's a sign that there's dysfunction going on in their body and that they need to help get their core working better again for them.
Good.
So my Confidence in the Core, Floor, and More course can help women understand and get started with their exercises. The Restore Your Core program is awesome for if people are more into the yoga, Pilates kind of exercise routine. That's an awesome program. And then there's the Bloom method that is more exercise based exercises. So there's all different, there's tons more out there. Boy,
Loads of
Chris,
different things.
when
Yeah.
I first started doing this back in 2009, there
Yeah.
was nothing on the internet.
Yeah, I
And
know. I know.
and there is so much more now, which is awesome. Awesome,
Mm,
awesome. But one thing that I want to make sure that partners understand, and so that
yeah.
they can share this with their postpartum partners, is
Yeah.
that it's super important for their core to become reflexive again. It
Yeah.
needs to become automated again, meaning that every time you go to stand up, your lower belly draws in to help get you to stand up.
Yeah.
Whenever you go to cough, your belly draws in. Whenever you go to
Yeah.
laugh, your belly draws in. And that happens automatically. Whenever you go to lift your baby, your core automatically strengthens to help give you better strength to be able to do the activity that you're doing. And so many times women, I've had them come in and we get them working and they know how to get their muscles strong by doing the exercises. But if they don't automate it, meaning that it's happening every single time they're doing something, then when they stop doing their exercises, their symptoms come back.
Yeah. Yeah.
So when it becomes automated, that automaticity keeps the strength going and it keeps them strong and it keeps their symptoms away. So our goal with any program that you're doing, they need to make sure that they are talking about reflexivity of the core system, automaticity of the core system, and that it's happening with everything that you do.
Yeah. Yeah.
So that's the key to full recovery after having a baby.
Yeah, it's a good point. It's a good point. So I want to ask you this now. So we've got to do this, and I'm going to do it then. You ready? So, I know that you know a lot. You've got a lot of experience, and you've obviously done a lot of reading about this, and that you've seen lots of patients, and you understand. But I know also that you've got children of your own.
Mhm.
So for you as a person, what would you have liked your partner to know about more to help you recover after your own birth?
Mm. Good question, Chris. Wow. I'm thinking back to myself. My kids are 24 and 22 years old. So, almost 25 years ago.
Yeah,
I'm not sure that that part of me, I think what I would have liked is to my partner to have taken care of me more and
yeah,
to have pampered me more and to have brought me food, brought me water, like have known more of what I needed at that time. I
yeah,
didn't know what I needed and he definitely didn't know what I needed at that
yeah,
time. Okay.
yeah,
So partners listening in, it's like your mamas, your newly postpartum mamas, they need nurturing food. They need warm food. The
yeah,
warm food, their body doesn't have to process it. If you drink cold food, so your body is in a massive state of healing. It's trying
yeah,
to heal that dinner-sized plate wound inside of it. And the more cold food that you eat, the more your body has to rev up to warm that food down in order
that's
to process
more,
it.
yeah, good point.
So, having my partner say, "Can I get you some soup? Can I," and to have like hot meals being prepared and ready for me so that, like it's amazing when you're dealing with a baby and trying to breastfeed. I just remember looking around my house going, "Oh my God, a tornado just hit,"
Yeah,
because there's all
yeah,
this baby paraphernalia all around and
all
everything,
around
and
the place, yeah,
all around the place. You're just like, holy cow, all this for one little baby. But to have my partner preparing me hot soups and hot meals and bringing that to me and to
mm,
making sure that I have water every time that I breastfeed,
yeah,
like
big
to really
deal.
be supportive of
Mm,
that, I think would have been really, really helpful
mm.
for me.
So we have a slang saying in the UK that I'm going to teach you now. No
Okay.
shade, no shade. It's like saying, like I don't know an American euphemism, but it's like no shade is like no stress. Like I'm not trying
Yeah.
to bring any bad stuff to your partner.
Yeah.
No shade at all.
Yeah.
But we can all learn together. And like
Yeah.
the things like you said to yourself, your kids are 24 and 22 now. And like I know for myself that I'm gonna definitely send this video to my friends. And they might just be like, just having babies, or maybe their babies are young. Obviously, I get the privilege of being able to watch these things as well, and my
Yeah.
babies are young. And I'm like, to hear you, even though, yeah, obviously, I know you've got a lot of medical knowledge, but to hear you say one of the biggest things for me was that my partner, if he pampered me more, it
Yeah.
makes me feel like I'm not. There's so many things I can do because I can bring a glass of water to my wife when she breastfeeds, and I'm
Yeah.
hoping that my friends who watch this will be like, "I can do that. I can heat up a
Yeah.
meal, no problem. I can do
Yeah.
that." I'm hoping that they will watch this and be encouraged, be enthused, and be like, my efforts here are not wasted. It's not-
Right, because I think as a partner, a mom is just trying to figure this baby out and figuring out the whole breastfeeding thing. And
Yeah,
so it's like being postpartum, you're thirsty and you're hungry like that. And
yeah,
And it's like, I'm breastfeeding, but I'm hungry, and so moms are just like, I remember, like, just grabbing whatever I could
Yeah.
in the moments in between,
Mm,
to that, it would have been really nice to have, like, "Hey, what can I get you? Okay,
mm,
are you hungry? Are you thirsty? What can I do for you?"
yeah.
You know?
Yeah.
Because and that's your role. Your role is to support your partner in nurturing your baby.
Yeah. Good shout. Good shout. So,
Yeah.
Lynn, that you and I can keep talking forever, and we often do. But is there anything else that you want to say to the people listening as we close now?
Yeah, so I think, I want everybody listening in to understand that birth is a very, I'm gonna say it, I wish there were another word, but birth can be a very traumatic experience for some. And that trauma can live in our body. And what I've shared today is a more normalized postpartum recovery. These are some of the things that can happen to someone who's not traumatized. And if we add the traumatized person to this, everything gets
Heightened.
heightened big time. Yes.
Yeah.
And so thank you. And so it just makes it more challenging and if your partner had a traumatic birth, then you witnessed that trauma yourself. So you are also traumatized yourself. And I think that we just need to name that and to be aware that that is a thing and that you both need to get support to get healing around what has happened.
Yeah.
Okay. So today Chris and I talked about a lot of the physicality of the postpartum recovery piece,
Yeah.
but there's a huge emotional, energetic, and trauma informed level of healing that may need to happen for some
Mm,
that I just want people to be aware of and know that there is healing available. So
yeah.
no matter what your partner is dealing with, whether they're dealing with hemorrhoids or fissures or prolapse or stress incontinence, pelvic pain, back pain, there is support. There is healing available
Yeah.
for your partner. And
Yeah.
please also be aware that trauma is a thing that occurs very often in birth.
Mm,
And
mm,
your partner baby may be traumatized, but the thing is that you may have witnessed the most beautiful experience that you've ever experienced in your life and thought it was absolutely great, but
yeah.
your partner could be traumatized.
Yeah. Good point.
So trauma is only through the perception of the person experiencing it.
Mm,
It doesn't matter. It just matters on what their perception of the birth was. Now,
mm,
here's the thing, Chris. I had a client come to see me and she told me the most traumatizing birth story and after birth experience that I've ever heard. And I
yeah.
kind of went, "Oh my gosh, what am I going to find in her body?" Thinking I'm going to find a lot in her body, right? Because the trauma is stored in the tissues of the body.
Mm,
And when I put my hands on her, there was nothing. There
mm,
was no I couldn't find anything in her nervous system, in her tissues, and I asked her, I said, "What did you do?" And she said, "I processed the birth with
mm,
my partner and my doula 3 times, talking about what I was feeling
mm.
during the event." Okay? So, going over what happened in the birth experience can be healing if
Itself. Yeah.
done in a way where you're reworking what you were experiencing, feeling in that moment. The feeling piece is the key piece to it.
Yeah.
Because when trauma happens, you're overwhelmed, your system gets overwhelmed and it can't process what was going on and what it was feeling in that moment. So
Yeah.
if you just replay a birth from start to finish without really dissecting it and going into the feeling, you can actually re-traumatize yourself more.
Yeah.
Okay. So if we don't want to do that. But if you can go back and do a play-by-play of each moment, but really focus in, okay, how was that for you? What
Mm,
were you feeling in that moment? What was going on for you? And you can have a discussion with your partner that may be healing.
mhm.
And
Wow.
if it's not, please go get help. There are trauma therapists all over the world, people who
That's
specialize
true.
in
That's
working with trauma. Please go search and work with them and know that no matter what's happening, healing can always happen.
Yeah, healing is available. It's really good.
Yes.
It's really good. It's really good. And it's remembering as well that you do not need to suffer in silence. You
Yes.
need to suffer in silence. Like,
So
and we all
important.
have different perspectives, but really, Lynn and I were here for everyone, and we're trying to encourage people and give the voice to the dads and to the moms. But it's a good thing.